Well, the current practice, which is a combination of 4 cytostatic agents called ABVD, has been around in standard of care for 3 decades. So it's been challenged many times. Some remedies have shown better progression-free survival, but never better overall survival. So it's actually it's a hard one to beat. But there is an advantage in progression-free survival, which means that less patients with the new combination, including brentuximab vedotin, will fail first-line treatment or relapse at a later point in time. So this is really important. Advanced stage Hodgkin lymphoma is a disease that is really important to cure in the first go, because in order to obtain cure later on, if the patient relapses, first of all, it's more difficult, it's less likely, and also the treatments that you have to give are really toxic with the risk of long-term toxicity. So cure in the first line of treatment, really important, and this new line compared with the ABVD standard shows a roughly 25% reduction in the risk of failure. So that's really quite important. It's difficult to predict how this new and more active combination will find its role. Obviously, it will mean the chance of cure for more patients, maybe also for more elderly patients who would otherwise find it difficult to tolerate more intensive regimens. But of course, there is a question of access to novel drugs, novel expensive drugs. It's difficult to predict how that landscape will turn out. But certainly this is more effective, and it will be interesting to follow the hopefully soon coming approvals.